lipedema, not lymphedema, lipedema. My name is Matt Cash. I'm a lymphedema therapist that also treats people with lipedema, and I get asked a lot about lipedema. So we're doing a 6-part series based on information from the Lipedema Foundation, which you could find at lipedema.org. Great information. What is lipedema? This is part 2 of 6 of treatment options and care. Lipedema is a chronic medical condition characterized by a systemic buildup of adipose tissue fat in the legs and arms. A common but under-recognized disorder, lipedema may cause pain, swelling, and easy bruising. It may be accompanied with an unusual texture within the fat that can feel like rice, peas, or walnuts under the skin. This is not lymphedema. Not lymphedema. Nope. And it is not obesity. Nope, it's lipedema. Lipedema Foundation has sent me this. This is their lipedema care and treatment options. These aren't for everybody, not for everybody, and a lot of these are not for people with a damaged lymphatic system. You got me? I'll point them out when we come across. But we're going to be dealing with this one right now. Decreasing adipose tissue. What? Forever it was said, if you have lipedema, you cannot lose weight. That is not true. We know that's not true. You can decrease your adipose tissue. And you want to, if you can. Here are some strategies to do that. Let me get out of your way. Starting at the very end. Reduce non-lipedema body fat. Yes, we all have fat. We all got it. We got it. All right? We got it. This is normal fat. If I wanted to lose my normal fat, I could do that. But I'm lazy, and I know that. But you can lose your normal fat, is what I'm saying, and have a positive benefit on the diseased adipose tissue, which is full of inflammation. Those are two separate things, right? So decreasing non-lipedema body fat by improving your diet. And we talked about a lot about diet up there when it came to managing inflammation. Keto diet, low carb, GLP-1 medications. Now, I have had several patients with lymphedema, and these medications have been a benefit to them. It's also been a benefit to the people that are on the GLP-1s with lipedema, and I have one that I know of, she's kind of famous, that is on that, that's also having a good reaction. Bariatric surgery could help reduce that normal adipose tissue and investigate liposuction. As a therapist, I must put my 2 cents in here. Liposuction, in my opinion, is very invasive. And yes, the techniques have improved greatly, phenomenally, but it's still an invasive procedure that potentially can cause more harm than good, especially to the lymphatic system. So when people ask me about liposuction, my answer is, if your quality of life is really impacted and that could benefit you, sure. If your quality of life is not really impacted, is it worth it? Because what we know about lipedema is we could get rid of a lot of that adipose tissue, but it still forms over time. So it's not a cure, not a cure. Let's look at building muscle and strength to help decrease adipose tissue. Exercise is good. It would be good for me. I am doing better. I go to the gym twice a week now, along with my typical hiking and disc golfery. Ways of eating. See, these are all starting to blend together because that's the way this works. Fasting and elimination diet. Elimination diet doesn't mean stop eating. It means you're starting to eliminate certain things out of your diet, and hopefully that's a benefit to you. And again, some gut health, gut healing, yogurt, probiotics, prebiotics, all those sorts of things, supplements, medications. And then we have, of course, exercise. We have aquatic exercise, which is phenomenal for lymphedema, by the way. Walking and hiking, lymphatic yoga, rebounding, cycling, Pilates, weight training, elliptical, and Tai Chi. Now, if you do have lymphedema, I would be careful about the rebounding because of the jarring. It depends on how you do it. But all these other ones are phenomenal. When it comes to lymphedema, you want to honor the delicacy of your lymphatic system. So there's things you shouldn't do with that when you have lipedema, when you want to get real aggressive. That's fine with lipedema, but lymphedema, you want to be a little bit more careful. So decreasing adipose tissue is a way, according to the Lipedema Foundation, lipedema.org, as a treatment and care for people with lipedema. So hopefully this helps. We have 4 more of these to go through, so stay tuned.